Hi to everyone. I am Dr. MAURYA from Department of Orthodontics, School of Dental Sciences, Babu Das University, Lucknow. Now I am continuing my lecture of fixed orthodontic appliance, second part. So now I was discussing about the components of fixed orthodontic appliances, the passive components, and other parts I have discussed in fixed orthodontic appliance part. In second part, I will continue the remaining components and various orthodontic appliances. The separator. The separator is used to create space between the two adjacent teeth for the purpose of bending. So this is the first step for the formation of band. For this purpose, the various types of separators are used, like soft brush wire. These are made up of 0.5 to 0.6 millimeter diameter brass wire, which are placed interdentally around the contact point and they are twisted to create the space. So these are most painful and the twisted ends, it may cause laceration of gingiva mucosa. Second is casing separators. These casing separators, they are made up of oval 6 special plus Australian wire with helices. These are available in forms or we can make custom. So on when open state arm which pass below the contact point, then sufficient space is created within 48 hours after the application of casing separator. Next is elastic separators. These are most commonly used separators. So these separators are small elastic rings that are stretched and pass through the interdental contacts using a special plier called separator placing pliers. With this, the separation takes place for 7 days. Next is dumbbell separators. So these dumbbell separators, they are made up of elastics that is stretched and passed through the contacts between the adjacent two. So these elastics of separators constrict over time to regain its original shape and thus causing separation of two. Next component is elastics. Elastics can be latex or non-latex. The non-latex elastics deteriorates less as compared to the latex elastics in the oral environment. So they are available in various strengths and colors depending upon their diameter and thickness. So the elastics are chosen according to the clinical use. Like class 1 elastics, these are used in the class 1 fashion. So these are intra-arch elastics. They are placed mainly between the molars and anterior. So these are used to close the space by retracting anterior or protection of posterior to close the space. Second is class 2 elastics. So class 2 elastics, these are intermaxillary elastics. They are placed between the membrane molars and maxillary anteriors. Since these are used for the correction of class 2 malocclusion, So these are class L, class 2 elastics. By this, the lower molars, it comes in mesial direction, and upper anterior it goes in posterior direction. So it helps in correction of class 2 malaplegia. Next is class 3 elastics. These are also intermedullary elastics placed between the upper molars and lower anteriors. So these are used for class 3 molar correction and retraction of mandibular anterior. So since these are used for class 3 correction, so it is called as class 3 elastics. Then diagonal elastics. These are intermedullary elastics. They are placed diagonally between medullary and mandibular anterior. So these are used for the correction of midline. If upper and lower midline are not coincides, then these elastics are used. Next is box elastics. So these are also intermedullary elastics. Involve two teeth in medullary and two teeth in mandibular. These can be used to correct anterior open bite during occlusal settling, or these can be used during occlusal settling, maybe in class 2 fashions, or used in the class 3 fashions also. Next is triangular elastics. These are also used during occlusal settling. Next, extraoral elastics. These are heavy elastics. These are used in conjunction with extraoral appliances like headgears and face masks. So they apply heavy force. Next, elastomerics. The elastomerics, they are made of synthetic polyurethane materials. They are used in various forms along with fixed orthodontic appliances. First, elastic chain, which is also called as E-chain. These are used mainly for the space closure. They are available in different strength. It may be long, short, or close, depending upon the space between the two rings. Then elastic threads made up of special elastic cottons. These are used for correction of derotation and space closure, and also for traction of impacted tooth, like here. Next, elastic ligatures, they are available in various colors. The elastic ligatures are used to secure the arch wires in brackets. In it may be either in edgewise or in pre-adjacent edgewise brackets. Next is elastic modules or elastomeric links. They are made up of two elastic rings. These are elastic rings. They are separated by variable distance, like these are small size and larger size. Here is small and larger size. These are used for correction of derotations and also used in the space closure. They are available in variable size based on the inter ring distance. These are rings. These are available in various size. The springs are auxiliaries which are used to generate tooth moving force. The varying types of springs are available. It may be open coil spring, closed coil spring, uprighting springs, rotating springs, and torquing springs. The open coil springs, these are open coil springs used for opening a space. For this, the springs of appropriate length is compressed between the two teeth to open up the space. These are made up of either stainless steel or nitride bars. And these are closed coil springs. These are used for closing of spaces. The springs is stretched and attached at two ends for closing of space, like here implant and in the anterior. It may be made up of stainless steel wires or nickel titanium wire. Uprighting springs made of 0.12 or 0.14 Australian wires. They move the tooth root in a medial or in distal direction. Yeah. And rotating springs, as its name suggests, that these are used for derotation of the tooth. They are capable of both clockwise and counterclockwise movements. These are used in bags and tippets technique. Torquing springs generally used in the bags techniques, made up of 012 or 014 Australian wires, used for labial or lingual torquing of tooth. Magnets. The magnets are active components used along with the fixed orthodontic appliance for the purpose of space closure, attraction mode, as well as regaining of lost space, as in repulsion mode. Magnets used presently are samarium cobalt magnets or neodymium iron boron magnets. Then I am discussing about the various fixed orthodontic appliances, evolution of edge-wise appliances and various other appliances. First, edge-wise appliances. Edge-wise appliances are introduced by Edward H. Engel, who is the father of orthodontics, modern orthodontics. So initially, he advocated extraction of teeth in certain cases and designed an appliance to tip adjacent teeth into these spaces. Like this is simple appliance. Later, he became convinced that a full complement of teeth was essential, and he advocated expansion for gaining of space and give the e-appliance. He was the great follower of non-extraction treatment philosophy. The evolution of edge-wise appliances. First, Engel gave the E-arch appliance. The first typical orthodontic appliance was E-arch appliance, expansion arch appliance. It consists of that rigid framework with molar beds here and heavy labial archware with threaded ends. The ends are threaded here, threaded in. Teeth are tied it by means of brass ligature wire. These are brass ligature wire and capable of tipping tooth movements. These are the plain arch, expansion arch. These are ripped expansion arch. These are the E-arch, various types of E-arch. These are rigid framework. They have a band and molar tooth and tooth are tied with the brass ligature. Next, pin and tube appliance. It was given by the E.H. Engels. Here the bands with tube shoulder on it for each tooth. So pin shoulder are arch wire and made to fit into tube perfectly. The change position of pin shoulder, it again an arch wire to a different position and fit into the tube again. So these are the disadvantages because they are difficult to solder and unsolder the pins, and it is time consuming. So we cannot, it is very difficult to precisely place the pins over the arch wire. So it was the major disadvantage of the pin and tube appliance. These are the pin and tube appliances. These are the tube soldered to the bands, welded to the bands. These are arch wires which have a pins. Arch wires which have a shoulder field. Next, ribbon arch wire. It was also given by the angle. First appliance to use which have the true brackets. So modified the tube in which was used in the pin and tube appliance on each tooth to provide a vertically positioned rectangular slot. These are the rectangular slot here, vertically positioned behind the tubes. And gold ribbon 10 into 20 inch arch wire. This is a flat arch wire which placed in the tube and held with the pins. These are the pins which are used to hold the arch wires in bracket with good spring back quality with efficient alignment. But the disadvantage was the poor control of the mesodistal tip of the tooth. Then he gave a new appliance which is called an edgewise appliance. So to overcome the deficiencies of ribbon arch wire, Engel reoriented the slots from vertical to horizontal position. So dimension of slot were 022 into 028 inch of the same side of arch wire. So inserted a rectangular wire which was rotated 90 degree to the orientation it had with the ribbon arch wire, that is on edge. Hence its name is edgewise because it received the rectangular arch wire from the through its edge. So control tooth in 3 dimensions. So these appliances they control to 3 dimensions. The disadvantage is heavy force requires and complex wire bending in this technique. So there is increased friction and stall force for the anchors. In edgewise appliance, we apply a heavy force. These are the edgewise appliances. They have a horizontal slot. The wire receives in edgewise directions. Next, the contribution of Charles H.P. to the edgewise. The Charles H.P. who was the student of Engel, he devoted 42 years of his life for advancement of edgewise appliance. He developed concept of positioning of teeth over the basal bone, and he developed diagnostic facial triangle for the treatment plan. And he recommended extraction of the teeth, whereas Engels was opposed. He was follower of non-extraction treatment, but the tweet recommended extraction of teeth for gaining versus space to correct the molecule. And tweet established method of closure of extraction space in proper sequential manner. The treatment steps: first, diagnosis. The tweet used the diagnostic facial triangles for the diagnosis of treatment plan. There are 3 planes: FMA, lung, axis of mandibular plane, and mandibular incisors and mandibular plane. So he also advocated the concept of anchorage preparation in first degree anchorage, second degree, and third degree anchorage preparation, depending upon the distal tipping of the posterior jaw. Then bracket specifications: edgewise brackets 022 into 028 slots with a single or double timing. And the bracket positioning in maxillary and mandibular arch, brackets were placed 3.5 millimeter from the incisor or cuspal edge, except maxillary lateral incisor, which were placed 3 millimeter from the incisor edge. And all the brackets are centered mesodistally on labial or buccal surface of the He used the Bonville, Holly Bonville chart for arch fabrication. In this, width of the arch wire is dictated by the intercuspid and interbuccal segments width in the original molecule. And when the basic arch form is formed, then we make the first, second, and third order bends in the arch band. This is the first order bends which are made in horizontal plane to conform the anatomically to the labial and buccal contour of the tip. These are the outset, inset for the lateral incisors, outset for the canine, offset for the molars. Second order bends, these are made in the vertical plane. These are vertical plane. So used for the anchorage preparation, uprighting of the tip, paralleling of the root, and elevation and depression of certain. Third order bends used to move the root of the teeth labially or lingually. So in this, the arch wire is twisted to place the third order bends. So these are the outlines of treatment mechanics of quill. First, alignment and leveling of maxillomandibular arch, anchorage preparation, depending upon the malocclusion, then closure of spaces in various steps, and then root paralleling and artistic position of the anterior tooth, then finishing and detailing, then retention. The advantage and disadvantage of edgewise appliances. The advantage is precision. We can control the tooth movement in all three planes. And mechanical simplicity, cleanliness, and versatility. These are compared to the previous appliances. But the disadvantage is lack of system and vary. And depending on wire bending, because these statements are totally dependent on the wire bending by putting first, second, and third order bends in the arch wire. And also the anchorage demand because we apply heavy force. Next appliance is Beck's appliance, which was given by the P. Raymond Becks. At first, Becks was a follower of Engels' non-extraction philosophy. When he looked at after case of poor profile aesthetics and reliance, he advocated for the tooth extraction. The philosophy of Beck's appliance is tooth size reduction is required to compensate for the dietary changes. These are the Beck's. So he modified from the ribbon arch to get better control of the root position. The brackets were narrow slot, so less friction. He replaced the precious metal with oven 6 round stainless steel bar and Australian steel bar. Then he used the round wires instead of the rectangular arch wire, so which apply the less force. So he added auxiliary spring to control the root position, like torquing spring, rotating spring, and counter-rotating, counterclockwise rotation spring. So he used the various auxiliaries. And based on the light force and tipping of the tooth, because there is the lighter wires which apply the lighter force. So based on the concept of artisanal occlusion, he devised the light wire differential force technique. What is artisanal occlusion? It permits teeth to move towards their anatomically correct position in the jaw under the influence of very light force, as would occur naturally in the presence of attrition. And secondly, differential force concept. These two concepts are the main basis of Beck's appliance theory. So in differential force concept, The force required to tip a tooth is less than the tooth force required to move it bodily. So the tooth crown are initially tipped into the other desired position using intermedullary elastics like class 2, class 1 elastics. And the roots are then uprighted as a separate procedure using auxiliary springs. In this technique, first the tooth are tipped, then they are uprighted by help of auxiliary. But in edge-wise technique, from initial of treatment, they tend to move the tooth body. Next is treatment stages. It is divided into 3 stages. First 2 stages they involve the crown tipping, and third stage is restricted for the torquing, means root movement. So in stage 1, the alignment and leveling are done, closure of the spaces are done, over correction of rotations, over correction of overjet and overbite, and correction of the inter-arch relationship, means class 1, class 2, class 3. In stage 2, all the extractions are space are closed, and the objective is to achieve the in stage 1 they are should be maintained. And in stage 3, the corrections of tooth angulation and inclination, and objective achieved in the stage 1 and stage 2, it should be maintained. The advantage and disadvantage of best technique. Advantages: this is same systematic approach of stage, lack of frictions, better anchorage control, free tipping of the tooth, speed of the tooth movement, differential tooth movement, minimum wire bending, and minimal post-treatment relapse. But disadvantage is emphasis on extraction of the tooth and reliance on the elastics, class 1, class 2 elastic, class 3 elastic, complexity, fencing by use of the auxiliary springs and torquing screw. Oral hygiene are difficult because of use of auxiliaries, breakage, lack of precision, and lack of flexibility. Next, appliances is straight wire appliance, developed by Lawrence and Dole, which was based on the 6 keys to normal appliance. So he eliminated need of wire bending because first, second, third order bend they are given in the bracket. The proper bracket position allowed it to be placed with a straight wire into an occlusal contact with an excellent mesodistal inclination, which is called a tip, and excellent facial inclination, which is called a torque. So bracket were positioned in the center of clinton crown, and all the bends, that is first, second, and third order, they are built into the bracket. So the brackets, they have a particular base thickness to compensate for the first order bends. Like in upper Latin sizes, the base thickness is more for the first order bend. When a wire is engaged, the horizontal plane of the wire remains same, while the teeth align themselves labially in the ideal occlusion. So by this, first order bends will be expressed. For the second order bend, the slot of the bracket is angulated with respect to the long axis of the tooth. So this leads to the teeth being positioned in the ideal mesodistal angulation from beginning of treatment. And for third order bends, incorporated either by emulating the slot. This slot, either they are angulated with respect to the base of the bracket, or there are two methods: the angulation of slots with respect to the base, or angulation of base of bracket with respect to the slot. So these two methods are used for incorporation of third order bend. When rectangular wires is engaged, the torque value starts expressing themselves. So anterior bracket set were introduced for different skeletal patterns to facilitate the establishment of normal incisor relationship. So there are three sets of bracket: set S, set A, and set C. Set S for class 1 malocclusion, set A for class 2, and set C for class 3 malocclusion. And translation brackets, which compensate for the unwanted tooth movement that occur during closure of extraction spacing. The bracket sets of molars, premolars, and canine side increase tip and anti-rotation according to how much translation output to be expected. Next appliance is Roth appliance. So Ronald Roth, he recognized the importance of induced concept, but only in harmony with properly functioning of temporomandibular joint. He incorporated the 6 C's to normal occlusion with mandibular in gnatologic centric relation. He introduced the repositioning spleen to find the centric relation. Roth prescription. Roth introduced a bracket setup containing modification of tip, torque, rotation, and in-out bend movement of endo standard setup brackets, which was common for extraction and non-extraction cases. So these brackets are available in 018 and 0203. We also modified the bracket placement. The bracket positions were endo's facial axis point is the reference for the placement of Roth brackets. So in this, incisors are more incisively placed and lower canines are more gingerly placed. So these are the tip and torque values of upper and lower tip, and these are bracket positioning values. These are based on the position of these premolars, which are positioned in the centers, and these are the reference for the placement of the other brackets. Then next appliance is Bennett McLaughlin. They have a higher torque, they deliver light continuous force, decreased tip for anterior tip, and he designed three types of standard, mid-size, and lateral brackets. The MBT bracket, MBT appliance system, and bracket design. These are the mid-size metal bracket. The shape of bracket is rhomboid, and torque is placed in the base of the brackets. They are available in 018 and 022 slots. The thicker 0.5 millimeter brackets on the upper second premolar if they are small. The versatility of bracket system to provide wire bending and bracket positioning, anchorage control, early in the treatment, and group movement where possible. And there is canine place bags during the retraction. So it prevents the mesial movement of the tooth and correct midline and also protect the flexible arch wire. And bend bags, it helps to prevent the mesial movement of the tip. Next is tip edge appliance. It was developed by the Peter Kessler. It combines bags, light force, and anchorage control with edgewise and better finishing the tip edge system. It relies on free tipping during the initial phase of treatment, like in bags technique, and then using rigid rectangular arch wires, like in edgewise techniques, to apply the teeth later. It also requires auxiliaries for finishing of the tooth. So this has been achieved by designing narrow pre-adjusted edgewise brackets with base they are removed from the each side of the arch wire slope, which allows the bracket to tip 25-degree medial distance as the bracket tips. The width of the slot increases here. These are the bezier removed from the brackets. So the slot width is increased when the tip tips. So these are tip and toss in upper and lower arch. So advantages and disadvantages of tip step. Advantages: it permits tooth tipping in early stage of treatment. With progressive torque application, improved precision and finishing, versatility is increased, and express all the treatment built into the brackets and overtip. But the disadvantage is poor rotational control due to the narrow single beam brackets, friction due to elastomeric ligation, and dependence on the intermediate elastics, a relative complexity in finishing stage, rigid design, and dependence on the structure. Thank you.